Most of us don't realize that bad oral health usually leads to bad overall health.
But there are a lot of myths out there about the best ways to improve your oral health, so we're going to bust them all this morning. Joining us this morning to help us understand how easy it can be is friend of the show, Dr. Milad Nourahmadi, founder of Shining Smiles Dentistry. Good morning. Welcome back. How are you?
Good morning. Always a pleasure to see you guys.
Wait, do I have anything in my teeth?
No, you
Okay,
don't. Your
good.
teeth are beautiful. Boy, you got nice teeth.
Doesn't he though?
Yeah. I mean, how do you can't work on your
I
own?
work on myself. I look in the mirror and I'm just like,
No.
I do. I really do.
I
Get
always
outta
wonder
here,
about
seriously.
that.
Yeah,
You do?
I do.
I thought it was like dentists had to go to other dentists, but you actually are
You
able.
do, but for the most part, if I can do it myself, like I trust myself, so I know what I'm doing.
Well, listen, I hope you never need a root canal, because that could be one
That
thing I would
yeah,
really...
or wisdom teeth.
Right. See an oral surgeon for that.
Yeah, exactly.
So we're about to do a dental fact or fiction in a second, but you actually have an app now called Tooth Happy.
That's right.
Tell us about it. This is cute.
Yeah. So this is the app. What I realized is that there's a big lack of information out there when it comes to oral health. And most people learn about how to take care of their teeth from their parents, who usually don't have the best hygiene themselves. So I figured, besides just helping the patients that come through my office, how can I help the public in general? And so I created this app, and it's packed with features that will help you with your hygiene and also give you information about the connection between your body and your mouth and how you can prevent a lot of diseases.
This is huge.
Yeah, it is. Because remember
huge.
when he came in and he talked about like the proper way to brush and
Yep.
things like that? Because it's like we learned when we were kids,
Exactly.
and things have gotten a lot better since we were kids too. Even if we were, you know, taught well then, it's not the same as what's important right now.
Right, information changes, science reveals new things all the
Right.
time. And so this app is going to help people get the most up-to-date information in a way that's easy to understand, and it actually has like built-in floss reminders that are going to remind you to
that is
floss.
so fun.
Yeah, because that's the #1 thing. I can never get people to floss. They're always like, I forget. I'm like, well, now you got an app
Yeah.
that'll
You got- you
remind
got an app for- I got
You
an app for that.
Exactly.
All right, well, let's get to the fact and fiction. Are
Okay.
you ready?
I'm-
They're
yeah, ready.
always testing us here.
Playing a game. So we're going to start out with some myths. We'll see if we get these right or wrong here. Okay, here's the first one. Sugar causes cavities, fact or fiction? Well, I think it's the saliva that causes cavities, and then you get sugar in there. And
Close, close.
that's what
So
I'm-
I'm gonna go with fact.
you're going to go with fact?
You're gonna go with fiction?
I don't know. I mean, I guess I'll go with fiction.
Final answer. Fiction? It's fiction.
Oh.
So sugar is actually what bacteria digest, and they cause the cavities.
The bacteria
cause the
cavities.
cavities.
Got it.
Yep.
Okay.
Not
Gotta
the
wash
sugar.
away that bacteria.
Yep.
All right, our next one. I've heard this before. Putting an aspirin on a toothache will help it.
Okay, I've never.
Like I've heard if you put a baby aspirin on a toothache and let it dissolve there, that it'll help.
Okay, I think that's probably just that you're taking the oral anesthesia. You know, you're taking it in your body, and it's helping to soothe the pain. So it's. I mean,
I'm gonna
but
I'm gonna go with
Yeah.
fact. I'm gonna go with fact.
Yeah, it's actually fiction.
Oh, man.
because you're
I mean,
taking an aspirin.
once it gets absorbed into your
Right.
bloodstream, it'll
Then it
help
helps.
you.
Oh, okay.
But until then, it actually can cause what's called aspirin burn, which is a big problem. You get like a big burn on the side of your cheek from the aspirin, so
Okay.
avoid doing that.
Thank God I've never tried it.
Oh my!
Yeah.
I have never really even heard of that until
yeah.
just now.
I think
That's
it's
crazy.
an old wives' thing.
an
or
old thing,
something.
yeah.
Okay.
Okay, next up we have all fillings need to be replaced at some point, fact or fiction. Okay, Gina and I just went through this, right? We were
Fact.
talking about it because we had silver ones and now we have white ones.
Yeah. And some crowns
right.
and inlays. I'm gonna go with fact
Me
because they
too.
break down.
Yep.
Yeah.
And that's true. Yeah.
And it's captured
Fact.
in there and you don't know,
Yeah,
all the
just
other
like
stuff.
anything else, over time they wear and they've got to be changed out. So.
Okay.
Okay, thank goodness. All right, at least I got one
You guys
out
are
of
doing
three
good,
right.
yeah.
We did pretty well.
All right,
Yeah,
all right,
high
all right.
five.
You, need
Okay.
you both need the app.
Right, we did well. Did we get a free
No, you did.
toothbrush?
You got more right than I did, but I only got 1 out of 3.
Yeah,
Yeah.
she's
So, yeah.
33%.
I need
It's
to.
okay.
All right, you
I
got-
need to look at. He did the math real quick too. Listen, don't forget to check out the app. toothhappy.org, or you can visit the Apple App Store and search for Tooth Happy, no space, to get it on your phone. I think I'm going to download it today because I thought I knew a whole lot about Teeth Happy.
That's hysterical.